Hello everyone. I hope I am audible. So, welcome you all on this workshop today. This is being organized by Research Council of Patna Medical College in collaboration with the Student Research Council of Bharatiya Vidyapeeth Deemed University. And this is under the umbrella of GCMER, General Consortium of Medical Education and Research. Uh, a little bit about GCMER. This is an organization and its student research councils in different colleges aim to make research an integrative part of medical education in India. It aims to facilitate and promote a research-oriented mindset in the Indian healthcare students, hence making future clinicians who can practice evidence-based medicine and also compete with international standards of research. And I would like to welcome Dr. Pratik Joshi sir as our guest speaker today. Dr. Pratik sir is a consultant orthopedic surgeon and has done MS and DNB in orthopedics. We are extremely delighted to have you here, sir, and I request you to please guide us today throughout this workshop. Over to you now, sir, please.
Okay. Abhinav, is the screen visible?
Yes, it's visible,
Okay,
sir.
and the audio is okay?
Cool. Yes, the voice is clear.
Okay. So, good evening, everyone, and welcome to this webinar on the fundamentals of medical research and roadmap for ICMR short-term studentship of 2022. Now, at the outset, I'd like to thank a few people. Firstly, Dr. Oshin Bell, the founder and president of the GCMER and the entire global office bearers team for GCMER. They are the ones who basically started this entire concept of getting more and more people involved and getting more and more people motivated towards doing research. Second, of course, Dr. Abhinav Kumar here and the entire team of GCMER Patna. They have been working hard day in and day out. For the past week, I have been troubling Abhinav by constantly messaging him and telling him what to do and so on and so forth. Really good job, guys. Also, to the Student Research Council of Bharatiya Vidyapeeth Medical College, Sangli, who I have been told is on the organizing board for the event today. Before I move on, two more people I'd like to thank. One is Professor Dr. Girish Chandra Bartakke sir, Professor and Head of Department Orthopedics, and Dr. Srinivas Shintre sir, erstwhile Professor and Head of Department and current Head of Department of Trauma, both at BJ Medical College and Sassoon General Hospitals in Pune, which is my alma mater. Now, thanks to Abhinav, GCMER Patna, Global GCMER body, and BVP Sangli, what we have is approximately 210 registrations across 79 medical colleges all over the country. So I hope more and more people will join in as we proceed with the meeting. So thank you very much, guys, and let us get started. So just before I actually start talking about research and things like that, this is BJ Medical College. This is my alma mater and the institute where I'm working right now. We are a 1900 bedded super specialty tertiary care center with approximately 80,000 inpatients every year, 20,000 major surgeries, and the OPD across all the specialty and super specialty departments sees a turnover of approximately 750,000 patients annually. Attached to us is Government Medical College, BJ Government Medical College, Pune, which is one of the largest and oldest medical colleges in Maharashtra. We have 250 undergraduate seats with 170 postgraduate seats and 8 super specialty departments and 11 allied departments. So this is the institute where I've had the privilege of learning and where I have the privilege of working every single day. So our topic for today is the fundamentals of medical research and roadmap to the ICMR short-term studentship 2022. And my name is Dr. Pratik Joshi. I'm working as an assistant professor of orthopedics in BJ Medical College and Sassoon General Hospitals, Pune. This is where I also completed my MBBS as well as my MS in orthopedics. A year later, I completed my DNB orthopedics from National Board of Examinations, New Delhi. and I'm also a certified instructor for advanced trauma life support with the American College of Surgeons, USA. Along with that, I'm also certified in basic surgical skills and care of the critically ill surgical patients from the Royal College of Surgeons, London, UK. Apart from my areas of interest, which are traumatology and arthroplasty, I have some training in musculoskeletal oncology from Tata Memorial Hospital, Mumbai, Lower Parel, as well as Guy's and St. Thomas NHS Foundation Trust Hospitals and King's College, London. I'm a university approved undergraduate teacher with Maharashtra University of Health Sciences, Nashik. And as of 2022, I'm also a co-guide for the ICMR short-term studentship. So that's enough about me. And let's get down to brass tacks about what we are going to talk about this particular evening, and that is research. And at a very short notice, or in a very short manner, this particular slide kind of sums up what we are going to talk about over the course of the next hour. And that is, if at first you don't succeed, search, search, search again. And that is why it is called as research. It's called as research because you're going on and on searching until you get what exactly you want. So let's take a look at what exactly will be our objectives for the session this evening. So the first is that we will take a brief look at the basics of research. Followed by that, we will compare different types of research and we will see the levels of research or the hierarchy of research. Followed by that, we will of course take a brief look at every different type of research, be it a case control study, a cohort study, so on and so forth. Followed by that, we will try to formulate a stepwise approach to select a research topic. So a lot of you have probably enrolled for the short-term studentship, or a lot of you are in that stage of life where you are planning a particular research project. So this should probably help you as to finalize a topic and decide what exactly you're going to ask. Remember, research is when we ask a question and look for the answer. That is the basic dynamic of research. That is, we are asking a question and we are going to look for an answer. So designing a research question, and followed by that, we will have a sort of interactive or a live demonstration for literature search in medical research. We will take an overview of that. Followed by that, we will go through the skeleton of a paper, which means what are the headings that you must look into while writing or composing a research paper. And lastly, I will give a short briefing about the ICMR Short-Term Studentship 2022. Now, this entire thing is being recorded from GCMER side as well as my side. So I will be uploading this to my YouTube channel by later tonight. And I will provide the link for those who have not been able to attend or those who have to miss out. And so because of that, you will not miss out on any of what we are going to discuss here. So for the people who have absolutely no idea, I've been told that there are some first year and second year MBBS students as well who are joining us. So I'll just like to quickly encapsulate the basic research concepts in one slide. So what exactly is research? As we said before, research is a means of collecting information. So it's a systematized means of collecting information. And the theme of research is that you ask a question and look for the answer. So it is the scientific basis of question and answer. So instead of asking someone a question, you ask yourself the question and then go on and look for the answer in whatever research has already been published. So it is a systematized means of collecting information. And as we know, information available at a cursory glance can be incomplete, it can be biased, it can be incorrect, or even worse, it can be correct, but it cannot be relevant to what you are looking for, or it may be irrelevant to your social or demographic strata. For example, if you're looking for a particular distribution of a disease, but the articles that you're getting are from, say, sub-Saharan African countries, or if you're getting articles from Central Europe, and we all know epigenetics and disease patterns differ across Europe, across Africa, and across East and Central Asia. So you may get answers which are correct and relevant to a particular area, but not to you. So what do you have to do? The research involves, number one, picking out information which is relevant, which is reliable, which is reproducible, which means that when you finally go on to do your research project, what you get or the answers that you get should be somewhat in line or logically acceptable with what you have been reading about. And lastly, of course, they must relate to the present demographical picture. So these are the 4 R's of research. where it has to be relevant, it has to be reliable, it has to be reproducible, and it has to relate to the present demographic picture. So moving on, let's take a quick look at the different types or the levels of literature. Now, as you can see here, we have a pyramid, which means that somewhere deep down there is a hierarchy. So starting right from the bottom, what we have here is background information or expert opinions, which means opinions of one person or a set of people based on their knowledge and their experiences. No doubt um, these are valid opinions, but they are based on too small a set of patients, and they are based on too small a time period. So this is the lowest level of evidence. Above that, what you have is a case report or a case series. Followed by that, what you have is a cross-sectional study. Then you have a case control study. Then you have a cohort study. Then you have randomized controlled trials. And lastly, you have systematic reviews and the types, critically appraised articles, topics, and systematic reviews, which form the very apex, which means the best quality filtered information is in systematic reviews, and the lowest quality is background information or expert opinion. Now, let's quickly take a look at each of these types in person. So, this is background information or expert opinion. It is basically what you get after you listen to experts in the field talking about these things. So they may be speaking out of experience, they may be speaking out of their personalized understanding of a particular topic, they may be speaking out of um, having treated so many patients, so on and so forth. But no doubt, what the expert opinion says is valid. No doubt, it is likely to be correct as well. But remember that the opinion of one or a few people over a few set of patients is not a broad enough opinion to reflect the entire science or the entire literature as a whole. And that is why background info or expert opinion is something which is basically kept as a lowest level of literature. So it is the lowest level of evidence. It is some evidence. It gives you an idea of what is going on, but that is it, nothing more and nothing less. Next, we move on to the different type, which is case report or case series. Now, it is the next level where you have brought together a set of cases which are fulfilling a certain criteria. So, it could be something like the rarity of a case. So, you know that a particular disease is rare in the um, literature, but you have found a few cases of those in your institute. So because of that, you decide to publish it as a case series. Fair enough. Then unusual presentation of known disease. So in one of my upcoming publications, what I have is the presentation of a chondromyxoid fibroma, which is a bone tumor, a presentation of a chondromyxoid fibroma at the lesser trochanter of femur. Now, from the literature, lesser trochanter is one of the rarer sites of chondromyxoid fibroma. So chondromyxoid fibroma in itself is not an uncommon tumor. It is seen, but it is rarely seen at the lesser trochanter of the femur, and therefore what we found was that it required a different kind of management, and therefore we are planning to publish it as a case. So unusual presentation of a known disease or an unorthodox means of management. So if you have some kind of uh, different disease or a rare disease for which, say, the standardized management was not available or not applicable, in that case, then if you have applied some kind of an unorthodox means of management, then that can be published as a case report or a case series. Then an adverse case with a favorable outcome. I have another example for that in one of my recent publications from the year 2019. What we have is a young male who suffered a compound fracture of his proximal tibia, and we had to go ahead with an amputation for that patient since the patient had a vascular injury and the lower limb was devitalized. Now, this is a fairly common occurrence, but why it was adverse was because the patient was a known case of hemophilia. And so we were expecting that we will have torrential bleeding intraoperatively and we will have a host of other complications. But fortunately, we were able to expediently manage the patient. And under the cover of factors 8 and 9, and a good amount of coagulation factors, good amount of blood transfusions and systemic stabilization, we were able to ampute the patient and we were able to give him a good outcome. We were able to discharge him in a fairly healthy state. So it is an adverse case with a favorable outcome. Again, this is a very good criteria under which you can publish a case report or a case series. An unforeseen complication, uh, I remember seeing from a conference when I was an undergraduate student, when I don't remember the exact details, but a mesh was being applied for a hernia. So it was a laparoscopic mesh application, and the speaker was an established surgeon who was very famous for their laparoscopic and their mesh skills. And what had been done was that the mesh had been applied, and unfortunately this was a case from another institute, and unfortunately what had happened was that the company sticker of the mesh was left on the mesh, and therefore they had to go in again and take out that sticker. And that was what was shown in one of those conferences. This is from a different city, from a it was quite a long time ago. It must have been at least 6 or 7 years ago at the very least. So it is an unforeseen complication, something which is rare. So again, these case reports and series, they are a low level of evidence because one or two cases is not strong enough evidence. So the actual use of all of these things is more for purposes of generating academic interest and discussion. So when say I'm going to publish that article about the lesser trochanter chondromyxoid fibroma, it will um, it will basically make me think about chondromyxoid fibroma. It will have me go and read about the literature, so on and so forth. I would probably discuss it with my seniors or my friends, so on and so forth. And therefore, it is a low level of evidence, and it is more for academic learning than for actually publishing. So again, it is just the second from the bottom row in the hierarchy of our evidence. And now we actually start the kind of studies or the articles which are counted as solid research. So let us start with the first one, and that is called a cross-sectional study or a snapshot. There's a reason why I have kept a photo of a camera over here, and that is because the snapshot or the cross-sectional study is something which is the equivalent of going to a study population and taking a photograph. So what you are going to see is that there is gathering of data at one time, one single time, about exposure and outcome. Now let me give you an example. So if on a very basic level you wanted to make a study of people who are smoking more than half a pack of cigarettes per day, and the number of patients suffering from squamous cell carcinoma of the lung, or for that matter, if you wanted to take another topic such as intravenous steroid usage. Nowadays, in the COVID pandemic, we've had a lot of usage of intravenous steroid. And steroid, as you know, is a very strong risk factor for avascular necrosis of the hip. So, if you want to do a study between intravenous steroid usage and avascular necrosis of the hip, and if you were to go to a study population of, say, 1,000 patients and interview all of them over one period of time, at one time, that is one single interview, and divide them into four types of quadrants. One is exposed and outcome present, which means that the patient has received steroids and the patient has suffered from avascular necrosis. Second is exposed but no outcome, which means that yes, steroid has been given, but the patient does not have avascular necrosis. Third, unexposed but outcome present, which means that despite having not received steroids, the patient does not have your the patient has your avascular necrosis. I'm sorry. If despite not having steroids, the patient has avascular necrosis. And last is unexposed and no outcome, which means patient has not received steroids and the patient does not have avascular necrosis. So these are the four. You take one single interview and divide the patients into four categories. So on one hand, you will find that there are a lot of patients. Second, you will find that you are very easily able to divide between these four categories. But on the other hand, this is a study which is a static study, which means that it does not move backward and forward through time. So when you have exposed and outcome present, that is fine. When you have exposed and no outcome, you don't know whether the patient is going to suffer from avascular necrosis in the future, because you are taking only one exposure or you are taking only one reading. You are not following up the patients. Similarly, unexposed and outcome present, which means that as of now, the patient has not received the steroid, but the patient has avascular necrosis. You are again not going back into the history and seeing whether the patient has received anything else in the past. And last is unexposed and no outcome, again, not a problem. So, on one hand, it can give you a correlation, but on the other hand, all the data that you get is static, which means it is seen at one point of time, or you are taking a cross section of the society at one point, or you're just taking a photo. That is why it is called as a snapshot study. It's a snapshot study. Moving on, the next one level up, a further level up in the hierarchy is your case control study. So what you are doing is that you are identifying a set of people who already have. Now, we will build up from the concept which we were discussing in the last slide, and that is steroids and avascular necrosis. Here is the onset of study, which means as of today, 13th of February 2022 at 6 p.m., you have a set of these five people who have avascular necrosis, and you have another set of these five people who do not have avascular necrosis. Now, you already have the diagnosis with you as you start the study. Now, what you're going to do is that you are going to go backwards in time and go back and look for an exposure or the absence of an exposure. So you see all five people who have your avascular necrosis and go back, and you will find that some of them have had exposure to steroids and some of them have not had exposure to steroids. Again, you have a set of five healthy people, that is, people who do not have avascular necrosis. Again, you are going back in time, analyzing their records, and seeing that n number of people did not have exposure to steroid, n number of people had exposure. So the difference between the cross-sectional or snapshot study and this case control study is that snapshot was seen only at one point in time and then dividing on how many people have exposure, how many people don't, how many people have the outcome, how many people don't. In case control study, what you are doing is you are starting from there. You first start with a set of five people who have the particular disorder, in this case, avascular necrosis of the hip. You have another set of five people who are the controls, which means a set of five comparable people who do not have your avascular necrosis. And then you go back and see who has exposure and who does not. So this particular study proceeds backwards in time. It proceeds backwards in time. Again, the advantage is that there is some sort of mobility, which means that you are seeing the exposure over a particular time period. On the other hand, you are not following up the controls, which means that the cases, say you have five cases here and you have five controls. You are not going ahead to see what happens to these people. You are just saying that these five are healthy people as of today. Let us go back in time and see. Similarly, these people are cases, which means these people have the disease as of today. Let us go back and see. So that is case control study, or something which I used to use as an undergraduate student to remember is case versus control study, which means that you have two groups, cases and controls. Now, moving on, the third type, and that is one more level up in your hierarchy of evidence, is called as the cohort study. Now, cohort is a word which means group. So you have a group of people, and what you are going to do is the group is not whether they are healthy or whether they are unhealthy. The group is based on exposure over here. So You make a group of patients who are exposed to steroids. You make another group of patients who are unexposed or who have not received an exposure to the steroid. And now what you are going to do is you are going to follow up these groups, which means you are going to stay in touch with both of these groups over time. And what you're going to do is you're going to document findings for each of the groups. So what you're going to do is that in the exposed group, which means that the set of people who has received steroids in the time of COVID, you will follow them up and see how many of them, after being exposed, have developed your osteonecrosis or avascular necrosis. You will also see how many of them, despite having not been exposed, will have the osteonecrosis. You will also see how many people have been exposed but have not gone and developed osteonecrosis. Similarly, you will also see how many people have not been exposed and therefore they have not developed osteonecrosis. You will run statistical analysis on all of these and you will try to find out what is the correlation again between your steroid usage and your avascular necrosis. So, this is where you start the study not with a diagnosis. You don't start the study with patients who have a disease and controls who don't. You start the study with a set of people who has the exposure and a set of people who does not, and then you go ahead and you see what happens. So, putting it in another fashion, this case control study, you already have the cases. You're going back to see whether they're exposed or not, which means your study goes backward from disease to the exposure or from outcome to the cause. Whereas over here, you are starting with a set of people who are exposed or not exposed, which means you are starting with the cause. And then you are going ahead and you are seeing whether or not they develop the disorder or not, which means that you are going ahead from the cause to the effect. It is a prospective kind of a study where you are going back from the cause to the effect, going ahead from the cause to the effect. So this was the cohort study. And last, what you have in the set of trials is called randomized control trials, which means that you have a set of people who are given an exposure. The entire randomization is done, and the analysis is run based on the findings. This is something which would take a lot of detail. Therefore, I'm not going into a lot of detail into this as of now because randomized control trial itself is a big topic. But randomized control trials, and because of the randomization, which means that there is a complete random distribution of subjects as well as the cohort as well as the control sample, and there is a certain amount of blinding. We will get to this, which means that you have a near homogeneous distribution across all the study groups, and therefore your results are less likely to be biased. And that is why randomized control trials sit on top of all the other types of evidence or all the other types of studies. Above that, you only have articles which are subjected to critical appraisal and systematic reviews and meta-analysis. So randomized control trials, because of the randomization, which means a complete random distribution of patients and controls, and also because of blinding, they are the least biased amongst all the types of studies. Now, one thing which we have to do or we have to just go over is single, double, and triple blinding of the RCT or a randomized control trial. So a classic randomized control trial would be a placebo study, which means, say, the patients who are being tested for the efficacy of a new painkiller, and there is one set of patients and there's another set of controls who is being given a placebo. So when the study is unblinded, everyone knows everything, which means that the patient knows that they are getting the painkiller, the control group knows that they are getting the placebo, the investigator and the analyzer also know what is going on. Then you have the single blinded where the participant is blinded, which means the doctor knows that he or she is giving the painkiller to one group and the placebo to one group. But the person who is taking it does not know whether they have received the painkiller or the placebo. The assessor knows. Second is double blinding, where even the doctor does not know who is receiving what. So they provide the set of medications to each group. The participant does not know whether they have been given the placebo or they have been given the painkiller. The doctor also does not know whether they have given the painkiller or they have given the placebo. It is only the assessor who knows that this is the painkiller group and this is the um, placebo group. And lastly is where even the assessor is blinded, which means that they are just told group A and group B, and they are allowed to assess. And therefore, by logic, the triple blinded randomized control trial is the most unbiased kind of trial that is there, where there is no scope for bias or there is very little scope for the results to be biased towards a particular party, because the amount of knowledge being given to all the components of the study is very less, and therefore the results are fair and unbiased. So this was single, double, and triple blinding of the randomized control trial. Now, moving on, what we have to do, as we said at the start, what we have to do is a stepwise approach to selecting a research topic and going ahead with your research. And that is called as the standardized scientific method. So what we have to do is, first step is to ask a question. So you have to read about the topic in which you are interested. For example, going on with our example of avascular necrosis of the hip and steroid usage in COVID-19, then the first question that you would like to ask is, does intravenous steroid usage cause avascular necrosis? The reason for asking that question is because the use of intravenous steroids or even for that matter, oral steroids, both of them, the use of steroids in general has increased dramatically in the COVID-19 pandemic. So you would like to know if this is causing avascular necrosis. Then the next would be to state your hypothesis. And you state your hypothesis saying that I believe that steroid usage in COVID-19 has caused avascular necrosis. For example, then you conduct your experiment, you decide your study design. So it could be a cohort study, it could be a case control study, it could be a randomized control trial, whatever it could be. You design your study and you find out your results, go ahead with the analysis, make the conclusion, no doubt. And this is one step which everyone forgets, and that is, go back and see if the conclusion is answering your question. If not, then ask another question. So this is the standardized scientific method. This is how we are expected to go about a particular research topic. So ask a question, state a hypothesis, conduct an experiment, analyze the results, make a conclusion, go back and see if your conclusion is answering your question and whether your conclusion is supporting your hypothesis or whether it is refuting your hypothesis. So at the end of your study, you may get a conclusion saying that yes, steroid usage in the COVID-19 pandemic has increased the numbers of avascular necrosis. So it is answering your question and it is supporting your hypothesis. On the other hand, if you get in your research, depending on the kinds of patients you pick out, if you get a lot of patients who have received steroid, but you have just analyzed those patients for 2 months, then you would get that in the 2 months that I have analyzed these patients, there were no patients of COVID-19 who have received steroids who have developed avascular necrosis of the hip. So, does this answer your question? Partially. Can this refute or support your diagnosis? No, or your hypothesis? Not really. Which means that there is a potential area for further research, which means you may have to expand your study sample. You may have to increase the amount of time over which these patients are followed up, so on and so forth. Or you could finally get a result which says that no, the steroid usage in COVID-19 has not statistically increased the incidence of avascular necrosis. So, does this answer your question? Yes, it does. The answer is no, but it answers your question. And the second is that, does it do anything to your hypothesis? Yes, it refutes your hypothesis, because your hypothesis had said that I believe that COVID-19 steroid usage has increased the numbers of avascular necrosis, whereas your final result is saying that yes, this was my hypothesis, but my study states otherwise. Remember, all these outcomes are possible as long as you have followed the correct scientific approach, and as long as you have tried to eliminate bias wherever possible. There is no right or wrong answer. There is only the result of your studies. So this was the scientific method where we ask a question, state the hypothesis, which means you state what you think would be the answer to this question, then conduct the experiment, analyze the result, draw your conclusions, and go back and see if your question has been answered or not. So the next, of course, topic is how exactly do you design a research question? Because any kind of question can be asked, but you need to have a sort of set of guidelines, or you need to have a set of criteria by which you can answer or ask a particular question. So these are called as a finer criteria. These are available online, and I believe Dr. Oshin has taken a lecture online on the GCMER YouTube channel about how to design the ideal research question. So I think Abhinav, at the end of the session, you can just share the YouTube link of that, and that is a really nice lecture, and I really request that everyone who's watching this should also watch that. So these are the finer criteria. We have F for feasible, which means you have the adequate number of subjects, you have the adequate technical expertise, affordable in time and money, and manageable in scope, which means that is the study feasible or possible in a realistic time and a realistic budget in your institute. So if you want to do a study based on the PET scan or positron emission scanning findings of, um, say, metastasis of some very rare malignancy, you should be sitting in a center where you have the adequate number of subjects. So you should be in a primary referral center for oncology cases. You should be having either yourself or your colleagues who will be a part of your study, who have that kind of expertise, who can read and interpret those PET scan findings. You should have the hardware and the software required to do that PET scan. And lastly, it should be manageable in scope, which means that what are you going to do by doing all this? It should be a manageable scope. So this is F for feasible. Next is I for interesting. Getting the answer intrigues the investigator, peers, and community. This may sound like something very childish and out of the scope of normal research, but it has to be interesting. It must be something which has either academic interest or which has some sort of a something which makes people want to read it or makes people want to perform the study. No doubt, N is for novel, which confirms, refutes, or extends the previous findings. There is no use in conducting a particular study which will give you no new information. So, if we know, for example, that the most common bone tumor amongst malignancies, of course, the most common malignant bone tumor is secondaries, which means metastasis from somewhere else. Then I can no doubt use the existing literature. I can conduct a study somewhere in a center where we have the number of subjects and expertise and so on and so forth. I can be interested in finding out. But if my research question is, what is the most common bony malignancy? It is very well known. And my question is not asking something which is likely to give a different result or which is likely to extend the previous findings. It is just going to give a finding which is already known, in which case it may be feasible and interesting, but it is not novel. Moving on, it has to be ethical, which means it has to be amenable to a study that the institutional ethics review committee or your ethics board will approve, which means that you cannot cause any harm to a particular patient. For example, you must have heard that potassium cyanide is the most potent poison of all the poisons known to chemistry. But have you ever heard of any kind of a trial which says that we have a case control study of what happens when you eat potassium cyanide versus what happens when you eat sodium chloride, the table salt? You don't, because it is not ethical. You cannot divide people into a set of groups and give one person a poison and the other person common table salt. So although feasible, definitely I'm sure there are a lot of people who will find it interesting, and definitely we will get some novel idea, but it is not ethical, and therefore it is a complete veto, and you cannot do some kind of a study like this. You cannot design a research question saying what happens when someone eats potassium cyanide. So no, that is not. And lastly is relevant to scientific knowledge, relevant to clinical and health policy, and relevant to future research. So you may have a set of research question which is fulfilling all these criteria, but the knowledge or the information that you will get after conducting that entire study will be absolutely irrelevant, and it is not going to be useful to any of your further research studies. It is not going to be useful to the scientific community at large, and there is no use of the information that you are going to get in adding to the scientific knowledge. So then it could be all of this, but it could be irrelevant. So your research question should fulfill all these criteria. It should be feasible, it should be interesting, it should be novel, it should be ethical, and it should be relevant. And which means that it should fulfill the finer criteria, finer. So going back to the scientific approach, you use the finer criteria to ask a question. Then once you have asked the question, you stated a hypothesis, which means that you said that according to me, this is the possible answer to this question. Then you conduct an experiment on the lines of the types of experiments that we have seen. It could be a case control study, it could be a cohort prospective or retrospective, it could be a randomized control trial, so on and so forth. Then you analyze the results. You have to apply a wide range of statistical tests, and I am not going into that in this particular lecture because it is out of the scope of this current discussion that we are having. So I will not be going into biostatistics and mean, median, mode, averages, interquartile ranges, and your the different kinds of percentages, paired t-test, unpaired t-test, so on and so forth. It is the scope of an entirely different discussion, so I will not be going into that. And but you would like to analyze the results, make a conclusion, and try to answer your remaining question. So this is your scientific method. This was the final criteria. And of course, once you are done with that, while you publish your research paper, one thing which you have to do is your review of literature, which means that where does your study stand as compared to the existing literature? Does it agree with the existing literature? Is it not in agreement with the existing literature? If not, why not? And most importantly, are you adding any new findings? For which you have to scour the internet and scour the literature and get what you need, and you have to weed out what is not necessary so that you get the exact amount of information that you need. And that, my friends, is called literature search in medical research. So this is now the second part of the particular lecture, that is literature search in medical research. This is a live demonstration thing. I hope you like it. So there are different things we can do. There is a simple Google search which you can run. Followed by that, you can use Google Scholar. You can use mesh terminologies. You can search in PubMed. You can search using Boolean operators. Remember, Boolean operators is not its own separate search. They are a set of values which you can apply to your search string. Followed by that, you can run different kinds of advanced searches. So let's quickly take a look at what all you can do. And the first is a Google search. As you can see, what I'm doing over here is I'm searching Google for fracture distal end radius. Now I have kept this video looping so that you can see what exactly is going on. Now what I have done over here is that I have put in the search terminology of fracture distal end radius, and what you have is approximately 1.1 million results, 11 lakh 30,000 results. Some are from Wikipedia, some are YouTube videos, some are your different articles, so on and so forth. And it is a very wide and a very unusable kind of a data. Not more than 5 to 10% of what you get on Google is actually usable, but what you get is a rough overview. So when you try to search something about your particular topic on Google, only 10% is what you require. Everything else is based on what is going on. It could be the latest TikTok trend over here. It could be something about Valentine's week, which is coming up. It could be something about COVID, which is filling the internet all over the place. It could be memes about the office. It could be the roast of Jonas Brothers by Priyanka Chopra, the latest Spider-Man and his girlfriend, whatever. It could be all of these things which are absolutely useless. No doubt we enjoy reading about all these things, but it is absolutely useless from what you want to do. Nothing has anything to do with fracture distal end radius, but you will find results somewhere or the other. Only 10% of what you have over here will actually be useful. So Google search gives you 1.1 million results, and about 90% are unusable. So what you need to do, the very first basic thing is go to scholar.google.com. This is Google Scholar, and put in the same search terms which I had put over there. That is fracture distal end radius. As you can see, it has only 128,000 results as compared to 1.1 million in the plain Google search. So Google Scholar has effectively cut off those extra search related things which you don't require for this, and you have only your 10% relevant results. But remember, even the 10% relevant results are still 128,000, and we will all have disappeared from this planet by the time you finish reading all of these. And so you need to refine the search even more. So what you require is you need to modify your search string in terms of mesh terminology. Now, mesh stands for medical subject heading, where each article is indexed with PubMed and it has a set of terms associated with it. Remember, who chooses the terms? You choose the term. While you're uploading an article and providing it to the PubMed, you will give a set of mesh terms which you would like to be associated with your article. So it is a set of scientific minds who are uploading these research articles who are selecting the mesh terminologies. Remember, they are not random mesh terminologies. They are a pre-decided, you have to choose amongst a pre-decided set of words. This is from the uploader side of things. When you are going into search, you will have to select amongst those search terminologies, and only articles which are tagged with that particular mesh terminology will show up in your search. It is a controlled vocabulary thesaurus which is used by PubMed. Let me clarify the concept a little further, and that is hashtags on Instagram is equal to mesh terminologies on PubMed. If I put hashtag throwback Thursday, if I spell it properly, I will get all the posts across the length and breadth of Instagram which are tagged with hashtag throwback Thursday. Who tagged them? Not me. It has been tagged by the person who has uploaded the content. But punching in that hashtag into Instagram search box will pull out all those terms, all those posts, all that content which is tagged with hashtag throwback Thursday or hashtag love Insta good photo of the day, whatever. Similarly, when you search a particular string of mesh terms in the mesh database, it will pull out those articles which have been tagged with that particular thing, for which you cannot just search anything. You have to select amongst the vocabulary of that PubMed, which means amongst the set of terms which are known to PubMed, you have to select and it will pull out. Let us take a demonstration of this now. So what you have to do is, this is your PubMed, where right here at the bottom, what you're going to do is you're going to find this link called as mesh database and click on it. Now, I want you to watch. I'm typing in the same search string over here, and that is fracture, distal, and radius. And I put a search, and there are no items which are found. Now I put radius, and this gives me suggestions in which radius fractures was one of the suggestions. Now I'm just clicking on the mesh terms associated with radius fractures. And what I did was I found three results which had a combination of these three. So did you see how we changed from 128,000 all the way to three results, which are the three most specific results for this particular search? Now, the same thing can be done by mesh database. The same thing when you search in advanced search, you can punch in the same thing. Now I'm punching distal and radius fractures. Again, there will be no results because distal and radius fractures is not a mesh terminology. So put in radius fractures. Again, it gives you a list. Again, select what you want and you can go ahead. Somebody's mic is on. Can you please turn it off, please? Somebody's mic is on. Now, remember, what I'm looking for is fracture, distal, and radius. This was my original search string. Now, I may want not just fractures of the distal and radius, but I may want fractures of distal and radius with ligamentous injuries. I may want fractures of distal and radius with ulna fractures, or I may want fracture distal and radius with wrist dislocation, so on and so forth. So many times it is required that you have to combine keywords, and therefore when you add your further keywords, what you get is an opportunity to redefine your search criteria. You can broaden or you can narrow down your search, but what you require is your Boolean operators, which means what you require is to put mathematical operators between your search symbols, and let us see how they work. So you have to put in Boolean operators. So when you use AND as a Boolean operator, it is going to give you results which are common between this. So if I want peanut butter and jelly, or if I want distal and radius fractures and wrist dislocation, then the results which I get when I use the AND operator is only this common part, which will have results for articles which have peanut butter and jelly, which means they should have both distal and radius fractures and they should have wrist dislocation. Now, if I use OR, it is a widening of the search. So if I put in peanut butter or jelly, it will give me articles with jelly alone, it will give me articles with peanut butter alone, and it will give me articles where it is shared, which means I will get articles about distal and radius fractures alone, I will get articles about wrist dislocation alone, and I will get articles which have both the terminology shared. So AND operator is narrowing down my search and OR operator is broadening my search. And lastly is NOT, where I say that I want peanut butter, not jelly, which means I want articles about wrist or distal and radius fractures, excluding the articles about wrist dislocation. So not only will I get articles about distal and radius fracture, I will not get articles about wrist dislocation, and I will also not get articles where wrist dislocation and distal and radius fractures are both mentioned together. So this is a more specific search. So if you remember, this is our Google Scholar search from the previous slide where we had 128,000 results. Now, fracture, distal and radius and anatomy. So I have narrowed down the search and see how from 128,000 we have 50,000 results, because it has kept out the articles which have only distal and radius, it has kept out the articles which have only anatomy, and it has brought in only and only those articles which have fracture, distal and radius and the anatomy. So it has narrowed down your search. Now, instead, if I have OR operator, fracture, distal and radius or anatomy, so I have articles about fracture, distal and radius alone, I have articles about anatomy alone, and then I have articles where both are combined. And now see the number of articles. We have 228,000 articles, which means it is almost double. So it has broadened your search. Now, the next is fracture distal and radius, not anatomy, which means I want fracture distal and radius articles, but it should not have a any part about anatomy. So I don't want articles about anatomy. I also don't want those articles which have fracture distal and radius but also mention anatomy. So if you remember, we had 50,000 articles in the first one. We have 49,000 something in this particular study. So fracture anatomy is not a part of it. So these are the three Boolean operators and will narrow down your search or will broaden your search and not will rule out your irrelevant results. Last is your PubMed advanced search. Last, I think second last is the PubMed advanced search. This is actually very simple because you can just put in your different kinds of search terminologies and here you can choose your Boolean operators. Watch how it is done. Here you have advanced search, which is being clicked. Fracture distal and radius, the operator is here. From the drop down menu, you can choose whether you want and or not, and just go ahead and get. Again, you have 72 results. It's a very, very advanced and a very, very narrowed down search. Similar thing is Google Scholar advanced search. Go to scholar.google.com and there you have advanced search. All of the words means or, then you have exact phrase, at least one without the words, so on and so forth. And it's a very good thing to see that Google Scholar is slowly and steadily pulling up and getting good results, just like your PubMed and your mesh database. And Google Scholar is actually very much easier to use as compared to PubMed and mesh. So these were the kinds of ways in which you can go ahead with your literature search and medical research. Second last part of this lecture now is formatting, which is the skeleton of a paper. Now remember that whenever you have your research topic ready, you have your results ready, you have your discussion review of literature, you will have to approach different kinds of journals for publishing your paper, and those journals will give you something which is called as instructions to authors. So they will give you the format, and each journal is likely to have a different kind of a format, a different kind of a word limit. Many journals often also tell you the specific font and the specific font size which they want. So please be sure that whenever you are uploading or you are sending up a article for review, please adhere to the rules laid down by the journal. Otherwise, they are not likely to consider your paper for publication. Then you always have, these are the set of headings which is always there in any given research proposal. So you have a title, you have the set of authors, you have an abstract. Generally the word limit for an abstract is something like 200 words or 250 words, it depends. Then you will have a materials and methods, which means you will have to go into detail about how you did what you did. You will have to talk about your inclusion and your exclusion criteria. You will have to talk about how the sample size was calculated based on the prevalence of the condition that you are talking about, so on and so forth. Then you will have to talk about review of literature, where we just saw all of this, where you have to get relevant articles. Then you have to talk about your own discussion, your own results. Then you have to add a point about discussion. Now remember, what is discussion? A lot of people get confused between results and discussion. And the difference between results and discussion is that results is what your study says and discussion is what your study means, which means that yes, these are my results and this is how my study correlates with existing literature. So this is these say 1, 2, 3, 4, these results of mine are in line with the existing literature, which means my study is valid, which means that the existing literature is correct, which means that my study is also correct, and these findings are universal and they can be corroborated. But if you say findings number 5, 6, and 7, for example, are not agreeing with the existing body of literature, then you have to talk about why they are not agreeing. Maybe if you have um, a particular condition in which gastroenteritis is the most common presenting feature, but you have upper respiratory tract infections as one of the most important feature, then you may have to talk about how your hospital where you are conducting has these endemic the area is endemic for upper respiratory tract infections. You may want to talk about how the hospital is located in a uh, large metropolitan city, so you have a lot of cases of all these pollution and the pollen and dust related upper respiratory tract complaints, so on and so forth. So when your findings are not corroborating with the existing literature, then discussion is the point also, where you talk about why they are not corroborating. And last, also in the part of the discussion, some things which are there in the existing literature but your paper was not able to prove, or you have not included as a part of your study, then you can list those later on, and you can say that yes, these are the limitations of my study, where I have not been able to prove 4 5 6. I have not included 6 7 8 in my study, and because of that, this is a limitation of my study, and this represents a potential area for further research. So this is what you write in your discussion. A conclusion is just a few lines about this was our study, these were our results, and therefore this is the final crux. And lastly, you have to put in formatted references. The commonest formatting type is called a Vancouver formatting. Another accepted format is APA and AMA. This will be given to you in the instructions to authors, where they will ask you that please format your references according to the APA pattern, or please provide them in the Vancouver pattern, so on and so forth. So whichever of them is required by the journal to whom you are sending, please make sure you adhere to all of these instructions. So this was formatting, which is the skeleton of the paper. Majority of your papers will have this kind of a distribution. This is the format in which you have to write a particular paper. Last is just 1 or 2 minutes about the ICMR short-term studentship 2022. Now, I'm sure most of you have read about it on the internet, but it is an excellent short-term research opportunity. It has been going on for a long time, ever since I was in MBBS in first and second year, which was around 2009 and 2010. This has been going on, and you can have anyone from first year to final year MBBS. I think even BDS dental students, if we have any dental students in the audience who are listening here, dental students in the BDS colleges are also eligible for ICMR short-term studentship. It is a 1:1 ratio, which means that one student can work under one guide who has to be a permanent full-time faculty from any department from the same institute. So whichever department you are doing, for example, if you are doing under Department of Orthopedics of BJ Medical College, Pune, then one student will have to be allotted one guide from Department of Orthopedics, BJGMC Pune. You can have your study from any clinical, preclinical, paraclinical, any and all departments are eligible for that. They have provided 2 months for the research, and the stipend or the grant is 25,000 rupees per month into 2 months. That is a total of 50,000. This is a screenshot of the ICMR website, where they have given all the rules, and they are given in a fair degree of detail. I think 9th of this month was the last date to make your profile and to register for it, and up to 21st of February is the time period up to which you can submit your proposals. So if you are going into a topic and you are talking to your guides, please do it and make sure you submit your proposals on time. So this was about the ICMR short-term studentship. At this point, I'd like to also state that we have a student research council in BJ Medical College, Pune, that is Jignasa. And Jignasa is going to conduct a separate guidance session from the point of view of this ICMR short-term studentship. And Abhinav, if you're interested, I can forward you the details of that particular seminar as well, and you can collaborate, or you can at least talk to our Jignasa Foundation, and they will be able to help you if any students who are watching this are interested in registering for that seminar as well. That guidance will be done by two senior professors from BJ Medical College, Pune, who have upwards of 60 and 100 publications each. So it is something which you might like to attend. So these are the contact details which have been given for the ICMR short-term studentship. This is again a screenshot from the website as well. So you can just screenshot this, or you can visit the website. They have given an address, they have given a mobile number, and they have given an email. So please be in touch with them. Another generalized instruction is that please make sure that whenever you have a doubt, directly email the person in charge, instead of talking to say friends or people who have done it last year, because rules and regulations keep changing, and it is always better to have the correct information from the correct authority. So that was our seminar on fundamentals of research and short-term studentship. Thank you so much for listening. My name is Dr. Pratik Joshi. This is my Gmail, and this is my Instagram handle. If you want to get in touch and you want to ask some sort of doubts, or if you need some help, I'm always ready. It's always a pleasure to interact with people from across the country. And I'm also conducting free teaching of orthopedic topics on this particular YouTube channel called Rapid Revision of Orthopedics by Dr. Pratik Joshi. So this is something which I have been doing for a while now. This is there on YouTube. I'm conducting all these lectures on the necessary orthopedic topics for undergraduate students. We have approximately 5,000 subscribers as of now, and I'm planning to take it further as well. So please don't hesitate to get in touch. It's always a pleasure. And thank you to Abhinav. Thank you to Team GCMER. Thank you to Bharatiya Vidyapeeth Medical College and Hospital, Sangli Student Research Council, and of course to my alma mater, BJ Medical College, Pune. And I think that is all from my side. I'm stopping my screen sharing now. And Abhinav, over to you.
Thank you, sir. That was an amazing presentation and just very informative. And thank you so much for sharing your knowledge and
Thank you.
experience with us. And I hope all of us would have gained a lot of confidence in moving forward with the research journey. So now, as we have told our participants earlier, we will have a short question and answer discussion for about 5 to 10 minutes, depending on the
No problem.
question. So if anyone, yes, sir, are you saying something?
No.
Okay, so if anyone have any kind of questions, doubts, they can just put it in the chat box or can unmute themselves and ask it directly, whatever they prefer. So we will wait for some questions.
Okay, I can see in the chat box that the Jignasa webinar was yesterday. Okay, so I think we missed that particular date. No problem, but we have a very active research council in BJ Medical College as well, Jignasa, and we have a lot of entries for the ICMR from our side as well. So I'm sure if anyone wants to talk to their colleagues from across the country here in BJ, I'm sure Jignasa will be more than happy to get in touch. Is there anything else? Is there anyone who wants to ask a doubt? If you don't have doubts right now, my email ID was in the slide, and you can always pass them across to my email, and I will be. Yeah, someone is asking which year students should start working on the STS proposal. In my opinion, anyone and everyone who is eligible can start working. It is never too late and never too early to start working on research, because research is not something which you have to be uh, old enough to do it, or you have to be senior enough to do it. Research is about a mindset, and research is about a way of life. So the faster you get into that way of life, it will build your mindset and it will help you in your studies as well. So which your students, anyone, currently in BJ Medical College, Department of Orthopedics, we have three students who are doing ICMR STS, and I'm very proud to announce that one of them is a first MBBS student, and the other two are second MBBS students. They are just about learning their pre and paraclinical, but they have taken up research projects in orthopedics, which is very, very commendable. Someone else has asked, can we mention the place of study and the college of study in our STS research? Honestly, I am not sure. In general in general principle, when you are submitting a research proposal, you are supposed to not mention your college. So instead of saying that we conducted this study in Sasun General Hospital, Pune, generally what you say is that we conducted this study in the outpatient department of a large tertiary care center in Western Maharashtra. That is exactly how you would do it. As far as ICMR STS, I believe they would be following the same guidelines. So on a safer side, it is good to not mention in your study. No doubt, when you are applying for your the proposal, and when you are writing your authors, no doubt you have to write the designation. So there it is given, but in the study it is generally not mentioned. Then sir, how can we know who in our college is a guide? The best way is, first is to decide the department with whom you would like to do the project, and directly approach the professor and head, or whoever is deputed by the professor and head to basically handle these academic quests. and they will be able to tell you who is eligible as a guide. Generally, all permanent full-time faculty, that is assistant professor and above, are generally eligible for guides, but state-wise regulations vary. So the best person to tell you that would be your own professor and HOD of the department with whom you are planning to do it. Then, are there any other journals in which we can apply other than ICMR? Yes, definitely. If your department is willing to support through the process, and even if you do not unfortunately get selected for the ICMR, I hope you do. But if you don't, even then, you can always go ahead and talk to the head of department or your academic guide. Go ahead and complete the study and publish it as a standalone paper. I don't think that should be a problem. At our own department in BJ Medical College, we are supporting all the students, and we are saying that even if you, number one, if you don't get selected through ICMR, number two, if you don't want to apply in ICMR, you just want to do a research topic, our doors are always open. And so apart from ICMR, we have three other undergraduate as well as intern projects going on as well. And we are out of them, two are quality improvement or QI projects, which are being held very or taken very seriously, especially when you are applying abroad to countries like United Kingdom and USA. Quality improvement or audits are very important. So out of the six projects going on, three are ICMR projects, two are audits, and then we have one cross-sectional study going on. Then um, only those studies which establish a novel fact are published, or studies which prove an established fact can also be published. The answer is both. Surely, if your study is, even if it is a proving, if it is proving an pre-existing fact and adding something new, it is finally based on the merits of your study. So, for example, if I say that COVID-19 causing COVID-19 steroid usage causing your avascular necrosis in a hospital in North India, if I am able to find that the same thing is happening in, say, in my institute in Maharashtra, then not only am I suggesting that yes, this is the same thing, but also I am saying that this is not limited to population, it is happening all over the place, in which case it is strengthening the existing body of literature, in which case what you're going to get is definitely your article will be published. And there are many avenues where you can get these articles which are published, or these journals which are ready to publish articles. So again, that is something which your subject guide can help you out as to which are the good journals, which are the good impact factor journals. That is a point for another discussion. I think there is something on GCMER YouTube channel about that as well. And last is, are the articles on PubMed free to read? So some of them are and some of them are not. So if those are not, there is again, there are ways and means to get those articles for free, again, out of the scope of this discussion. So I think we will stop the question answer session at this point. And anyone who has any other queries, please email them to me. I will be more than happy to help you out. So back to you, Abhinav.
Okay, thank you so much, sir. So now we have come to an end of this workshop. We are extremely grateful to Dr. Pratik Joshi, sir, to take out some time for this activity from his very busy schedule, of course, and helping us to learn the basics of research. Uh, I would also like to thank Vandana, my colleague, who helped to conduct this workshop and manage the registration process very efficiently. And lastly, I would like to thank all the participants for joining us today. Thank you so much. And a certification form will be shared in the chat box. Please note that only the GCMER members will get the certificate. So if you are a member, please fill the form and your certificate will be dispatched in your WhatsApp chat box. Please fill the form and then you can leave the session. Thank you again. Thank you so much, sir.
Thank you.
Thank you for
Yes,
helping us and
I'll sign
guiding
off
us
now. Thank you
through
so
all
much.
the knowledge. Thank you. Hi, Vandana, if you are there, can you please share the link? Share the link for the certification form.
Just a minute, sir.
Yes. The link for the certification form have been shared in the chat box. So if you are a GCMER member, please fill the form for the certificates, and then you can leave this session. Thank you so much for joining. I hope it was worth your time. Thank you. Goodbye.